Hey everyone, welcome back. It's Dr. Frank Wen from Integrity Chiropractic. So if you have noticed, I've taken some much needed time off, but I am happy to be back here again with you guys, and hopefully we'll be making videos regularly again. So the purpose of today's video is meant to be a follow-up to the one that I made on what to do if you happen to throw out your low back and how you can go about fixing it. So assuming you're not in low back pain right now, this is gonna be more suitable for you, but I'm gonna take a minute here just to tell you guys that, if you happen to be in some extreme pain, it's great that there's resources now online, but don't be afraid to go in and get help from a professional nearby you. It's never great to be splayed out on the floor in agony for too long. So if you're not having success or, something just doesn't feel right or you don't feel confident, it's always better to call in and get help. So I'm gonna invite you to do that. You are definitely helping out a small business near you if you go in and get help. And with times like this, everybody will benefit from help from each other. So that said, what I find with people who often throw out their backs is that they tend to have chronically tight low backs. They may or may not necessarily be in pain all the time, but what I find is that maybe they've had some prior pain in the past, and so maybe they've learned to try to protect this area, whether it's conscious or unconscious. But whatever reason, the low back doesn't have a lot of good flexibility. And so the issue with that is, you may know that protecting your low back can be good for certain motions, such as lifting heavy items, but people who throw out their backs don't always do that from lifting heavy items. Sometimes it can be something as small as picking up a piece of paper from the ground. So what is actually happening? Well, as someone who used to have chronic low back pain for many years, I've noticed that when you're protecting the area a lot, your brain kind of gets used to that set length in your muscles that they like to work in. And so what happens is, when you start to deviate out of that area, your neurological system perceives a threat. And so, the muscles are actually quite complex. Our brain is always kind of monitoring, what their tension level is and, what their length is. And it's making adjustments to, make sure that we're protected and we feel comfortable. Well, the problem is you don't always know, what activity you're going to do that might take you out of that safe zone that you've been operating in for a while. And so when that happens, you might actually pull, on the muscle too much, whether you're damaging a, passive element of the muscle or you're overriding some sort of, neurological limit that's there. Either way, it's perceived as a threat. And so usually what happens is, our brain will tell these muscles to go on lockdown and it seizes up the area. And then you'll find yourself kind of leaning to one side. Usually I find to the side that really hurts, or kind of shifting a little bit to that side. And basically, your body is trying to offload that discomfort. And so, basically it's uncomfortable because now you got this protection mechanism and you can't do anything. You can't bend over. It's really hard to change positions. It's almost impossible to do anything. So assuming you're not in pain today, today's routines that I'm going to take you through are ones that I like to use on myself, as well as to give to my patients. I have simplified some of them so it won't be too extreme for some of you. But what I'm going to do is I'm going to separate this video into two parts. The first part, I'm going to do some passive stretching with you, what I like to do to help basically increase the threshold of what we feel comfortable with in our range of motion limits, and try to increase that a little bit. And then on the second half of the video are basically some exercises on how we can train our brain to basically use that newly gained range of motion that we've gotten from all the passive stretching. And so if any of this stuff you do feels uncomfortable, just stop. Again, if you feel like you need to go get some help, go do that. But definitely these routines I'm going to take you through, you don't want to be doing them if you're in pain, because it's not going to help you. So with that said, let's go ahead and get started. All right, so for this first part, I'm going to take you through some passive stretching routines to improve mobility in the low back, hips, and legs. You'll want a chair or stool to be able to do some of these moves we're going to go through, and I definitely recommend a pillow if you're someone who has uncomfortable knees on the ground. Other than that, most of these stretches are going to be about a couple minutes. I'm going to have a timer for you to be able to follow along. When time is up, I'll let you know and we'll switch to another position. Now, if anything hurts while you're doing this, please go ahead and stop. If you feel like you can do it, but it's a little intense for you, you're welcome to take a break as well. So with that said, we're gonna go ahead and get started. So the first position we're gonna go into is we're gonna do a child's pose, straight forward. Okay? And we're gonna hold this for 1 minute. So I'm gonna set the timer, and let's go. So what we're doing with this stretch is we're targeting the low back extensors straight on equally on both sides. So what we're gonna do now is we're gonna walk over to one side, to the left or right. This is gonna preferentially target one low back extensor a little bit more. Okay, and we're gonna hold for 1 minute. So the goal of today's stretching is to basically help you improve mobility in all sorts of different angles. You know, this is not inclusive of everything that I will do on my own, but I think most of these should be comfortable for the majority of you. So you may also feel this when stretching your lat a little bit too. Okay, and then we're gonna walk out to the other side. Okay. Same thing, hold for 1 minute. All right, so now we're gonna come out of that. We're gonna transition to going on our back. So what this stretch is going to do is gonna help stretch out your low back extensors and also add the glute into the picture as well. So keeping your upper body flat against the ground, we're gonna let the knees drop out to the side. And then what we're gonna do is we're gonna take the top leg and bring that foot in front of the other knee. And then we're gonna take our one hand opposite to the leg and just gently pull down on the glute there. Okay, and so we're gonna hold this for 2 minutes. So some of you might feel this one a little bit more than others. This is a subtle stretch to get a little bit of the low back and a little bit of the glute. And I tend to find that this stretch starts to build a little bit more as you get to the end of the time. back, gonna come back to the top position, and we're gonna drop our knees out to the other side, bring the top leg over in front of the other knee, and we're gonna use the other hand, just pull down gently and hold. So 2 minutes in this position. So you may be wondering, why am I making you hold stretches for this long? Well, this is based off of some research that I've seen in regards to passive stretching. And so it's not clearly understood how our muscles are lengthening when we do stretches, but what we have found is that when you hold it for longer periods, usually 3 minutes and up, and that's usually how long I hold my stretches, that's where you tend to see better gains in mobility. And so there's some evidence to suggest that some of these gains in mobility that we're experiencing is actually due to an increase in the pain threshold that we have at the end of the range of motion, as opposed to us completely just lengthening the muscle. So now we're going to come out of that and we're going to switch to our chair. Alright, so I'm going to have you take a seat on your stool or chair. And what we're going to do now is we're going to do a stretch to target our hamstrings and our low back together. And so you're going to stick one leg straight out in front of you. And what we're going to do is we're going to reach forward. Now, some of you might be able to get straight to the toes. Some of you might only be able to get about to the shin. Wherever you feel comfortable, that's going to be your starting position. We're not going to force anything. We're just going to let it slowly open up over time. So 2 minutes. Alright, come out. We're going to switch to the other side. right, we'll come out of that position. And so since we're already sitting in our stool, now we're going to incorporate a stretch to basically target our low back extensors again, but more preferentially on one side. And so I'm going to lean to my side. Okay, 2 minutes. If you want, you can grab the other side and help you anchor a little bit better. So I'm leaning to the left here, and so you'll probably feel this pulling a little bit more on your right low back extensors. Transition to the other side. Again, 2 minutes. You're doing a really great job. We're more than halfway to the end. And with this stretch, you might be feeling a little bit of pulling into your quadratus lumborum. It's a nice little broad muscle that runs from the top of your pelvis down to your lower rib. And you might be feeling a little bit in your obliques as well. So now we'll come out of that. So this is where we're going to use our pillow again and our chair. We're going to go into a half kneeling position here to target our hip flexors. And the reason why we want to target our hip flexors too is because these muscles attach to our low back. And so if these get really tight when you stand up, that can make it more difficult for you to open up across the front of the hip joint. And so for some people, that might make you compress in the low back a little bit more. And so what we want to do is we want to try to open up the low back joints as well. Okay, and so we're going to do 2 minutes in this position. I'm doing this one, I like to lean a little bit more forward. You might see some people do this stretch with their arms upright or body more upright. Now, the reason why I'm trying to keep more forward is because I want to open up my hip flexor without compressing my low back too much. And so for some people too, you might find it's helpful if you have like a little yoga block or a little weight or something that you can set your hand on if you need it. Halfway. I know this one might be really tough for some of you. Slowly taking your time to come out of it because you might feel a little crickety. Okay, and I'm gonna go ahead and switch positions. Okay, and again, 2 minutes. And take your time coming out of that. Very good. All right, so we're going to go into our last stretch now. So again, welcome to sit on the pillow if you need it. So we're going to cross our legs, but we're going to keep one shin in front a little bit. And then what we're going to do is we're going to lean forward, and then we're going to go opposite to the leg, to the side, opposite to the leg that's in front. So what you're going to do is you're going to feel this stretch, target your low back, extensors, and a little bit of your glute, and a little bit of the outside of the leg. Okay, so we're gonna hold this for 2 minutes. Our last 2 stretches, you're almost there. position, so other shin forward. And then we're gonna walk out and then over to the side opposite to the shin that's in front. All right, and then we're gonna do 2 minutes in this position too. All right, great job. And so what I'd like you to do is just go ahead and take a few minutes to just lay down flat on your back to recover from this stretching. You might need a little bit of time to rebound, as you may not be used to holding some of these for that long. And so you might be wondering, when is a great time for you to do these stretches? And so generally I tell my patients that for passive stretching, I like to do it more towards the middle of the day and the end of the day, and definitely not before I'm going to do anything strenuous. And that's because I've seen some studies that have shown that you lose a little bit of power and strength after you do some long stretches like this. And if you're going to go do any sort of like yard work or move some things around, I don't want you to be weak. And so I like to use this as a way to just kind of wind down my day and just help relax. So go ahead and take some time, and as much as you need, and just go ahead and lay on your back and recover. So now that I've taken you through a passive mobility routine in the first part, in the second part, I'm going to take you through an active mobility routine. This is basically to help reinforce what we've gained in the first part, as well as being a really great tool to help you warm up before you go and do anything strenuous. And so you have a little bit more flexibility in when you can use this. I generally like to do this before I work out or before I go and do anything in the yard. And so these are going to be a little bit shorter than the passive stretching, about a minute for each of these movements we're going to do, and they're going to be active. So I'm going to set the timer. Just go ahead and follow along with me. If something doesn't feel right, you can go ahead and stop and take a break. Otherwise, this will go a lot quicker than the first part. So for the first position, we're going to get into a quadruped position on all fours. And then what we're going to do is we're going to rock back into a child's pose. So we're going to do this for 1 minute. So if this looks familiar to you, it's because this is one of the routines I had you go through in that prior video that I made for you to help fix your thrown out back. And so what we're doing here in this mobility drill is we're just trying to teach the brain that, hey, it's a safe way that you can go about elongating your low back muscles because there's not a lot of load on the lumbar spine in this area, and so usually most people are going to feel comfortable doing this. And so we're just trying to help build confidence in being able to perform this motion when you need it. going to transition back to our seat. Okay, again, it's going to be similar to that prior video I made. We're going to start by doing some forward ground touches. So just for 1 minute. So sometimes people ask me, how fast should I be doing these? I don't want to do it too slow where you feel like you're cautiously trying to guard the area, but I don't want you to do it too fast either. So I say somewhere in between your slow speed and your high speed. All right, and so now we're gonna go to the side, same exact movement. So we're just gonna reach out to the side and come back. All right, now we're going to switch and go to the other side. Okay, so since we're already seated, now we're going to do some seated trunk rotations. We've kind of been working more linearly, so now we're going to work on a little bit of rotational movement. So just a minute, we're just going to do some trunk rotations side to side. All right, so the last two movements are going to be done in a standing position. And so the first one we're going to do is called a walking toe touch. Now, I'm going to do it stationary so that way you can see me on camera. And so what you do is you keep one leg in the rear and then you bring one leg in front, keep the knee locked out and then bending the toes up. And then you're going to reach down and touch it and then stand back up. And so what you're doing right here in this position is you're actually trying to feel a nice active stretch from your hamstrings and calves all the way up into your low back a little bit. So we're gonna do 1 minute of this. And so if you're doing this outside, you can do this anywhere. You can just kind of walk and go as you do it. All right, and so then the last movement we're gonna go through is a hip hinge. Some of you might already be well versed in this movement. And so we're just gonna practice it really quick, and then we're gonna do a little drill that I like to do that involves kind of reaching. And so what we're gonna do is we're gonna come up, stand about feet shoulder width apart. And so we're gonna basically just practice almost squatting. And so what you're trying to do is you're trying to learn to keep your back uninvolved in this movement. You're trying to keep it straight. So you're trying to generate all the bending and lowering of your body through the hip and knees and your ankles. And so there's many ways and angles you can go about using the hip hinge. And it really just depends on, what you're trying to, reach for or what you're trying to pick up. And so the key is you really want to get good at just doing this movement through the hips, because once you kind of understand that, you'll be able to play with different angles at the knees or whatnot to help you get to where you need to be. And so we're doing this mainly just to help you learn how to spare the low back. Now, I'm not going to use a hip hinge to tie my shoes or bend over and pick up something really small and light. But if you're going to be doing anything strenuous, this is a really good movement to learn for you to learn how to basically get into your glutes and hamstrings a little bit, so that way you can spare your low back. And so some of you might find it useful to have a dowel on the back of your head and the small of your back, and you probably have seen this exercise where you try to basically maintain contact behind your head and the small of your back, as you bend through the hip. That's totally fine if you want to do that. So some of you might need to spend some time learning to practice this. One common thing I often see is people will round the low back when they do this one. And so what you're trying to do is learn how to keep your core a little bit stable and engaged and let the motion happen through the hips. So if you need to practice this some more, you can. Otherwise, what we're going to do now is we're going to transition into a hip hinge, touching the ground. So this is another nice active stretch that you'll feel for the hamstrings and glutes. And if I have to usually pick up anything somewhat heavy, I'll use this. So we'll practice for this for a minute. All right, great job. So that concludes our active mobility drills. So there you have it. I've taken you through some passive and active mobility drills that I like to use with my patients and myself to help improve and maintain mobility in the low back, hips, and legs. It's not exhaustive of everything I like to do, but it's not a bad start either. And so hopefully if you're consistent with this over time, you'll start to find yourself feeling a lot better. And if you are, that's probably a great opportunity to start branching out and doing some other things such as yoga and personal training, as those can kind of help you keep building on your fundamentals. So as always, thanks for watching everyone. Please like the video and subscribe to the channel. I'll see you next time.